Cannabis is often used to enhance or change the nature of sexual experiences, attributed to its effects on heightening sensations and lowering inhibitions. People might use cannabis to feel more relaxed, emotionally connected, and sensitive to touch, which can make sexual encounters more enjoyable and intense. However, while cannabis can reduce anxiety and increase pleasure, it also has the potential to impair judgment and affect decision-making. This can lead to challenges in communication, consent, and safe sexual practices. Here, we'll explore how cannabis influences various aspects of sexual activity, from boosting attraction and arousal to its impact during sex, discussing both the positive enhancements it can provide as well as the possible drawbacks. Cannabis, also known as marijuana, is a psychoactive substance that's typically consumed by smoking or vaporizing dried plant parts, ingesting it in edibles, or using oils and extracts. The main active component, THC, or tetrahydrocannabinol, enters the bloodstream and interacts with the brain's cannabinoid receptors, affecting mood, perception, and behavior. The effects of cannabis can vary widely depending on the strain, the amount consumed, and individual factors such as tolerance and body chemistry. Initially, cannabis can elevate mood, enhance sensory perception, and create a feeling of well-being. However, higher doses or particular strains can lead to less desirable effects, such as anxiety, paranoia, and impaired motor skills. Cannabis is known to alter mood and perception, which can have varied effects on sexual desire and attraction. For some, cannabis enhances libido by lowering inhibitions and increasing sensitivity to sensory experiences, making the initial phase of sexual interaction feel more intense and engaging. Users often report heightened perceptions of attractiveness and a greater emotional connection to their partners, potentially fostering a stronger initial attraction. However, the impact on sex drive can be inconsistent, with some individuals experiencing a decrease in libido. This variability can depend on the strain of cannabis, the individual's mood and environment, and their physiological response to cannabis. Cannabis affects individuals differently, with some strains inducing relaxation and others energizing the user. This can influence arousal and energy levels significantly. Indica strains are known for their relaxing effects, which might reduce energy levels and arousal over time, potentially leading to a more subdued sexual experience. In contrast, sativa strains might enhance energy and alertness, boosting arousal and motivation for sexual activity. However, the relaxation often induced by cannabis can sometimes be so profound that it leads to lethargy, which might hinder the initiation of and enthusiasm for sex. The use of cannabis can impair cognitive functions, affecting decision-making and risk assessment. While it typically does not provoke the same level of risk-taking behavior as alcohol, it can still lead to poorer judgment concerning safe sexual practices and consent. Users might find themselves less capable of making rational decisions quickly, potentially affecting their ability to negotiate safe sex or fully understand and give consent. The altered perception caused by cannabis might also influence how risks are assessed, sometimes leading to increased caution, but other times to negligence. Cannabis use often enhances emotional experiences and can lower psychological barriers, which might help increase feelings of openness and deepen emotional connections between partners. Users frequently report feeling more empathetic and in tune with their partner's emotions, which can facilitate a more intimate and meaningful connection prior to engaging in sexual activities. However, if used in excess, cannabis can also cause paranoia or anxiety, which might negatively impact emotional openness and lead to miscommunications or a sense of detachment. The use of cannabis can alter cognitive and sensory perception significantly. It tends to enhance sensory experiences, making tactile sensations more profound, which can increase the enjoyment of physical touch and intimacy. This heightened sensory awareness can make sexual encounters more enjoyable and engaging. However, cannabis can also impair short-term memory and lead to a fragmented sense of time, which might affect the flow and coherence of sexual activity, occasionally making the experience feel disjointed or less satisfying. Cannabis is known for its ability to enhance sensory perception, which can increase the intensity of tactile sensations during sex, potentially making the experience more pleasurable. Users often report enhanced touch sensitivity, which can deepen the physical connection and increase overall sexual satisfaction. However, as with all cognitive alterations, if the sensory enhancement turns into sensory overload, it might lead to discomfort or disorientation, affecting how pleasure is experienced and perceived during sexual activity. Cannabis has complex effects on arousal and physiological responses. It can enhance sexual arousal and endurance in some users by reducing anxiety and increasing body awareness. However, cannabis can also lead to difficulties in achieving or maintaining physiological responses, such as erection and lubrication, especially when consumed in high doses. The relaxing effects of cannabis might suppress the nervous system too much, leading to decreased arousal levels and a lack of physical responsiveness, which can impair sexual performance. The emotional and psychological impacts of cannabis during sex can enhance the feeling of connectedness and intimacy between partners, making the emotional component of sexual experiences more intense and gratifying. However, the mood-stabilizing effects often found with cannabis can vary, and for some, cannabis might induce feelings of paranoia or anxiety, which can disrupt the emotional closeness and lead to negative experiences. The drug's influence on emotional perception needs to be carefully managed to avoid these adverse effects. The impact of cannabis on sexual performance and staying power can be beneficial or detrimental, depending on the individual and the context. Some users find that cannabis helps them last longer during sex by delaying orgasm and enhancing endurance, while other users might struggle with diminished control and a lack of focus, which can shorten the duration of sex or reduce satisfaction with sexual performance. The afterglow period following sexual activity can be profoundly affected by cannabis use. Users often experience enhanced feelings of relaxation and satisfaction after sex, which can contribute to a positive reflection on the sexual encounter. However, if the experience involved anxiety or discomfort due to the effects of cannabis, the post-sex reflection might be less positive, influencing future sexual encounters and perceptions of intimacy. In conclusion, cannabis can affect sexual experiences in various ways, enhancing sensations and emotional connectivity for some, while potentially leading to decreased libido and impaired decision-making for others. Its ability to alter perception and mood means that while some users may find sexual encounters more pleasurable and intimate, others may experience anxiety or a detachment from the moment. It's crucial for individuals to understand the unpredictable nature of cannabis and its effects on sexual interactions. By being mindful of the strain, dosage, and personal reactions to cannabis, users can better navigate its influence to either enrich their sexual experiences or recognize when it might not contribute positively.